Intrauterine suturing procedure. Objective: to train hysteroscopic suturing and knot tying skills. Instruments: the hysteroscope with an instrument channel, needle holder, knot pusher, scissors, suture thread, intrauterine device. Suturing steps: hold the hysteroscope with the left hand and operate instruments with the right hand, following the procedural steps. The 9 suturing steps are: secure the ring, insert the needle, suture, pull the thread, remove the needle, position the ring, form the knot, push the knot, cut the thread. Step 1. Secure the ring. The suture is fixed to the stem of the Mirena ring. Sutures: non-absorbable sutures with needles, 1/2 arc, needle length 2026 round needles, sutures longer than 75 centimeters. Tie the non-absorbable suture 30 centimeters from the needle end to the stem of the Mirena ring. Ensure the tail of the suture is long enough for extracorporeal knot tying. Perform this step on the operating table. An assistant may facilitate the process. Due to the slippery nature of non-absorbable sutures, secure the knot with 4 throws to prevent slippage. Pre-suturing hysteroscopy. Perform hysteroscopy to assess uterine cavity morphology and endometrial thickness. If the endometrium is thick or polyps are present, perform endometrial curettage or polyp removal to ensure proper suture depth. Step 2. Insert the needle. Pass the needle holder through the hysteroscope's instrument channel and clamp the suture 0.5 centimeters from the needle end. Under hysteroscopic visualization, introduce the needle and thread into the uterine cavity. Adjust the needle position endoscopically, clamping the posterior 1/3 of the needle with the needle holder. Under the action of uterine distension fluid, the needle has a floating sensation, and the needle angle can be adjusted by the contact between the needle tip and the uterine wall. Step 3. Suturing. Identify insertion point 1 centimeter below the uterine fundus, offset 0.5 centimeters laterally. Insertion technique: advance needle vertically into the uterine wall. Gradually push until the needle tip emerges into the cavity. Note: due to uterine space constraints, if the needle doesn't penetrate fully in one pass, use needle holder to make multiple small advancements until tip is visible. Gently withdraw following the needles. Curvature to prevent breakage. Step 4. Pull the thread. Clamp suture with forceps. Slowly withdraw the hysteroscope while maintaining tension. Gradually pull the thread until visible at the vaginal orifice. Step 5. Remove the needle. The stitches at the vaginal opening are removed. Step 6. Position the ring. While pulling the thread, insert the IUD attached to the end of the thread into the uterine cavity with a ring-feeding forceps. Blind placement or under hysteroscopic guidance. Tighten the sutures to avoid accumulation of sutures in the uterine cavity. Step 7. Form the knot. Tie the knot with both hands outside the vaginal, opening in the same way as a surgical knot. Step 8. Push the knot. Pass the knot pusher through the hysteroscopic instrument channel. Pass the end of the suture through the small hole at the top of the knot pushing device and tighten the suture. Under direct visualization, advance knot into the uterine cavity. Critical. Maintain bilateral tension for smooth passage. Position the knot adjacent to the sutured site. Firmly secure knot with pusher tip. Repeat steps 7 and 8, 4 to 5 cycles, due to non-absorbable suture slipperiness. Exit the hysteroscope. Wrap the knot around the vaginal opening and push into the uterine cavity again. Complete 4 to 5 knots. Important. For IUDs with tail strings, cut during step 1 to prevent entanglement. Step 9. Cut the thread. After completing 4 to 5 knots, replace the scissors and cut the sutures 1 centimeter away from the knots. Hysteroscopy to check the position of the IUD. Procedure complete.